Obviously, we have a lot of residents that are listening into this discussion. If you think back to you as a resident, and you can go back and talk to yourself while you were in residency, what's one thing that you would tell yourself knowing what you now know?
Get more time with your favorite professors. Those folks are gold. And I think it's really important to recognize those folks that you have that bond with and to pick their brain, discuss, to talk. I think that was probably the one thing that I missed the most being out of training is those folks that were just literally an office away, a phone call away, and still are in some senses, to have that shelter of education and being able to discuss and talk about cases and really taking that opportunity on. I think also within just residency itself is if there's something that you're not seeing in your training, ask if there's opportunity or elective time to go do that. And so, for example, TMS was just kind of coming out and becoming a forefront when I was in residency. I asked for rotations to do that. I wanted to be part of that and be engaged with interventional psychiatry because I knew that's where the field was headed. So I think just advocate for yourself if you're seeing something in your program that you haven't had a lot of experience with or wanting to engage with, is ask if there's an elective. And I think the other key piece too is my administrative background. You don't get taught that in training. So if you have any interest in leading organizations or trying to build procedures and policy, ask folks that are doing that if you can do an administrative elective with them. If you'd like to learn aspects that are still very important within medicine, but that may not be just clinical in nature. I have residents that rotate with me now just to learn the nuances of having to argue with payer mixes and how do you create a policy of safety on a unit. And so those types of rotations are vital too, just to build your leadership skills, because there's not only a need for psychiatrists, there's a need for leaders in psychiatry.
Thank you, Dr. Carter. Very good advice. Dr. Wakim, same question. If you could go back to yourself while you were in residency, what's one thing that you would tell yourself then, knowing what you now know?
Yeah, it's a great question. And actually, Dakota took a lot of what I would have answered, which is, there's definitely power in knowledge, and you don't get taught business and generally in, medical school or residency. So understanding medical, reaching out, mentoring, understanding medical business, to Dakota's point, there's a lot of need, not just for direct patient care, but also for administrators and leadership within the field of psychiatry. As it continues to expand, there's a lot of APP programs with specialization now in psychiatry. So there's a lot of people that need administrative support, and there's not a lot of that education in residency itself. And the other one, again, just from my background and what I do a lot of now, is that interventional piece. When I was in residency, TMS was a thing, but it was a very nebulous thing, and not understanding it, or understanding the opportunity in it. It took me years to do that outside of residency, and had I engaged in that earlier, it might have been a different trajectory from where I am today. But those two things for me are what I would have wanted to know then that I didn't know at the time.
Thank you, Dr. Wakim. Very, very helpful advice. And lastly, Dr. Krugley, what would you say you would tell yourself if you could go back to residency?
Yes. Well, I think Dr. Carter's emphasis on mentoring and mentorship, seeking out mentors, is extremely important. I actually was thinking about making reference to that before we started, when I was preparing in my mind the importance of mentorship. As far as I had a strange experience, though, that people don't have anymore during their residency training. I trained in the 70s at a program that was actually dominated by psychoanalysts. And we were, and the residency group was fairly large, and we were working at a city hospital with very difficult, seriously mentally ill patients. But the teaching program and the mentoring that we received in the residency was all about psychoanalysis. That was, I don't know how many people remember this, but in the 60s and 70s, psychoanalysis was the dominant school of thought in general psychiatry. And the particular residency program that I was at was dominated, had actually an American Psychoanalytic Association Institute, the Downstate Institute, and the department was dominated by psychoanalysts. And we were being taught to interpret psychotic patients' delusions. I mean, it was pretty wacky. There were only a handful, maybe 2 or 3 people really in the teaching program that were interested in psychopharmacology. So we were very much oriented to psychoanalysis. And I really was, I was thinking about this before, most of my useful mentorship occurred after my residency. My first job at Bellevue, which was 5 years. And then I, after that, joined a private practice that was involved in geriatric psychiatry. And those 2 experiences, which probably covered about 9 or 10 years, was really where I was mentored and really learned how to practice psychiatry. The residency was more of an intellectual exercise, and I really don't use much of the information that we were kind of exposed to back then, although the listening skills were important. But I think the most important thing for early career psychiatrists, people in their residencies, I would echo what's been said. Look for mentors, look for people who you can learn from, look for people who you feel you can relate to, and seek them out and learn as much as you can. I would definitely go with that.